So hi everyone, in the previous session we did the chemomechanical preparation of this maxillary second primary molar, and we could easily clean all these canals with the baby blue file system, the pediatric primary rotary files, and we are now in a position that we could seal these canal or obturate these canal with a resorbable material. 1. This is the distobuccal canal orifice 2, and over here this is this primary, and this is the time we should be able to obturate these root canals once there is no bleeding. The pulp tissue has been successfully extirpated. So we need to first dry these root canals with the help of the conventional paper points. So right now the poll is going on how should our obturation material should be, considering the primary pulp canal treatment. So basically, when we talk about the primary molars or the primary teeth, then these primary molars should be, or the primary teeth have the resorbing roots, that is their roots resorb over a period of time. So the material should also be resorbing over a period of time, and it should not be acting as a foreign material. So we just need a material that should be resorbable, that should be non-irritant to the tissues. Just have these canals dried up. So over here this is the distobuccal canal orifice. Two, obturating material. Introduce the paper points in all these. After 30 seconds, minimum time should be 30 seconds when we have introduced into the root canal, so that all the and now one palatal canal is remaining. We should dry that canal also. This is tooth number 55. So we had selected the clamp number 55 for this particular tooth, and now we are going to obturate it with the help of a syringe based system, that is a calcium hydroxide plus iodoform paste in a syringe. So this is a resorbable material, it is antibacterial also, and it is non-irritant to tissues and has a good sealing and resorbable capabilities. So you should have this syringe based system, and also you should have the cotton pledget, the size of the orifice. So this should be your cotton pledget, the size of the canal orifice. Just condense it. Just let me show you. Now this one, and now you should begin with your obturation. Introduce your tip inside. We are first introducing it into the mesobuccal one over here. Before introducing it, you should be able to check whether the flow of this material is consistent That is, it should be not be much in a liquid consistency or not be much hardened. So when we check it over here, see the flow, it is in a good flow. So this is a must thing you should check before introducing it into the root canals. Introducing it in the coronal third and then injecting it with a mild pressure. See, you will see the rim forming at the orifice. So this is sufficient, not more than that. You don't need to push any material further. Now into the mesobuccal 2, again introduced it. Don't need to flow further, nothing, just this tip will show some resistance to withdrawal. So that is all you need to do. This is your material. Into the mesobuccal canal you have packed it, and now introduce into the distobuccal 1. Don't worry about that will it go to the tip or not. No, just introduce it with the mild pressure. If your the cleaning and shaping is fine, it will flow, and the canal is dry, then it will flow. And now in the final palatal canal, see how we have introduced it. You can see that we have introduced it into the orifices, the material all the way. And now is the time to introduce the cotton pledget. You can use it in a single canal obturation with the injecting it and then condensing the material. Over here we are condensing it as a whole. You have to twist it and twist it 360 degrees. That would just condense the material, squeeze it into the apical third also. And since you have introduced it, the material with the mild pressure, it would not go beyond. So individually you can introduce the material and squeeze it or condense it. Otherwise rotate it 30 degrees. And once your chemomechanical preparation is fine, the material will go smoothly. Now you can see that the material has been introduced into the canals. You just need to now clean up the things. So you can use the AtoZ bar over here to just clean up the things at the floor, as it would not perforate. So once done, and this is the time you can use a larger cotton pledget to just absorb the moisture. And now you can appreciate the canal orifices that have been obturated. This is the mesobuccal canal orifice that has been obturated, MB1. Then this is the MB2. Over here, this is the distobuccal canal orifice 1. This is the 2. And over here, the large palatal canal. So all has been obturated. So this is the time you can proceed with the post-obturative restoration, preferably the glass ionomer cement, and overall this should be protected with the crown, and preferably with the stainless steel crowns if the aesthetics is not desired. Unless otherwise, you can do it with the preformed zirconia crowns, the bioflex crown, and the Figaro crowns, or the other options that are available for the aesthetic purpose that you can do. And this is the obturation steps that you should be following. If you have any queries, you can ask in the comment section below this video. Thanks for watching, and we would be back with the next sessions on the pediatric dentistry or the pediatric endodontics. Till then, bye bye, take care.